Okay, we're gonna do an abdominal assessment, but first I'm gonna ask you a few questions. How's your appetite?
Good.
Any foods that you can't eat?
No.
You have any problems swallowing?
No.
Nausea or vomiting?
No.
Any pain in your abdomen? Do you have any history of any surgeries or anything on your belly?
No.
No problems? No history of problems?
No.
When was your last bowel movement?
This morning.
Okay. Do you have them every day?
Yeah.
The normal? Okay. Do you take any medicine to go?
No.
Okay. You want to tell me about your eating habits?
Usually have yogurt for breakfast, sandwich or something for lunch, and for dinner, whatever my mom makes.
Okay. Okay. So go ahead and lay back, lay flat, and lift your sweater up a little bit so we can see your belly. The first thing I'm going to do is just look at it. Just a little bit. Okay. So I'm looking at it and it is flat. It's all symmetrical. Your belly button is midline where it should be. There are no masses. There's no pulsations. Your skin is a good, clean, pale white color. No scars, no lesions. Okay, so that's all normal. Next thing I'm going to do is listen to your bowel sounds. And I'm going to listen in 4 different spots of your belly. Okay?
Okay.
Okay, so all your bowel sounds are there. They're not too slow, they're not too fast. So that's good and normal. Now what I'm going to do is listen in different spots on your belly to see if I hear any vascular sounds, any bruits. I shouldn't hear anything. So first I'm going to listen about right here. This is where your aorta is. And then I'm going to listen here and here where your the kidneys are. And then down here at the iliac, okay?
Okay.
So let me listen. Okay, I don't hear anything, so that's good and normal. Now I'm going to do percussion on your stomach, and that's where I'm going to put my finger and I'm going to tap and I'm going to see what I hear. So I should hear tympany. That's the sound that I should hear. I shouldn't hear dullness, and that's because when you lay flat, air in your intestines raises up. So that's why we should hear the tympany, okay?
Okay.
Okay, so it was all tympany, so that's normal. So now I'm going to palpate your belly. I'm going to do it lightly, and then I'm going to go back around and do it a little bit deeper, and you can tell me if you have any tenderness or something hurts, okay?
Okay.
Anything? Okay, and do a little deeper. Okay, everything feels normal. I don't feel any masses, nothing feels rigid, everything's smooth. So that's all normal. So the next thing I'm going to do is I'm going to try to feel for your liver. I'm going to palpate up for your liver. So I'm just going to have you relax and breathe slowly, okay? Go up under. And don't feel the border of your liver, which is normal. Okay. So now I'm going to go over here and I'm going to try to feel for your spleen, which I should not be able to feel, okay?
Okay.
So just breathe slowly and normal. And take a deep breath in. Okay, and another. Okay, and I don't feel anything, so that's normal too. So now I'm going to palpate your kidneys, okay? And I should not possibly feel anything. If I feel a little bit, that's normal also. I don't feel anything. I'm going to feel for this one. And I don't feel anything there either, okay?
Okay.
So now I'm going to have you set up on the side of the bed. And actually, one more thing, sorry, pull that back up. I'm gonna feel for a pulse, for your aortic pulse, and see if I can feel how big it is, okay? It should be 2.5 to 4 centimeters. I feel like it's about 2.5 and it's normal, okay? Good and strong. Okay, now I'm gonna have you sit up. I'm gonna have you scoot down here and hang your feet off the edge of the bed. And I'm gonna lift this up. Now, well, this is to see if you have any pain or tenderness in your kidneys, okay? Can you hold that up just a little bit? We're gonna come down here to the 12th rib. I'm gonna put my hand right here and I'm just gonna tap on it with my fist a little bit, okay?
Okay.
Any pain?
No.
Tenderness? Anything there?
No.
Okay. Okay, I think we're all done. So, any questions?
No.
Okay.
Hi everyone, my name is Alyssa, and this is my patient Abby. She's going to be volunteering with me today to do this abdominal assessment. All right. Abby, I'm going to be your nurse today. Is it okay if I do this abdominal assessment on you?
Yes.
All right, let's go ahead and get started. Abby, have you noticed, are you currently experiencing any abdominal pain or tenderness, anything like that?
No.
Okay, good deal. So the first thing I'm going to do is just kind of take a look at the abdomen, see if right off the bat I can see any discoloration, masses, bumps, anything like that. And right now, I'm not really seeing anything. Everything looks to be normal on Abby's abdomen on the outside so far. So now that I've completed that part, secondly, I'm going to auscultate. And so what we're going to do is we're going to start in that top right quadrant, and we're going to listen for bowel sounds. Okay. Alright, I did hear bowel sounds in all 4 quadrants of Abby's abdomen, and that's just important because it means that our body is operating correctly, we're having peristalsis, so that's good. Okay, and then secondly, I'm going to listen again, and I'm going to listen around like the splenic arteries, the hepatic arteries, and what we're going to be doing is just making sure we're not noticing any bruits, anything like that, because those are abnormal. Come over here on the hepatic side. Okay, not noticing any bruits. This is the splenic side. Okay, and then we're going to listen above the abdominal aorta, and that's just going to be right above the umbilicus. Okay, and then we'll listen to the iliac arteries. Okay, and then lastly, we will take a listen to the femoral. Okay. I did not hear any abnormal sounds like bruits or anything. So as far as auscultation goes, everything is intact. So thirdly, I'm going to percuss Abby's abdomen. So kind of what we're looking for is if you'll hear like a tympanic sound, if it's like above air, which is more common in like that center part of the abdomen. And then we'll also be looking for like a dull sound, and that means that you're probably above an organ of some sort, whether that be the liver or the spleen. So we'll start over here. Okay. Hearing that more dull sound. Whereas down here, a little bit more of the tympanic. And then when you're doing this, you'll want to use your right hand, if that's your dominant hand. Okay. And then we're going to come back over here to this liver area, see if we can kind of like measure it out. I believe the normal is anywhere from 4 to 7 centimeters. Okay, I'm not noticing any enlargements or anything like that. And then we're going to come back over to the splenic region. Okay, great. Well, everything seems to be intact as far as percussion goes. I'm not noticing any abnormal sounds. And so lastly, we're going to palpate the abdomen. And while we're doing this, we're really going to watch out for any tenderness or any masses. All right, so first I'm going to lightly palpate all 4 quadrants of the abdomen. Is that uncomfortable?
Nope.
Okay. We're going to start in that right quadrant. Swap over. Okay. And then we're going to do some deep palpation, and this is when it's really important to monitor for any masses or discomfort. Okay. And then we're going to come down to that 10th intercostal again, because the spleen isn't really something you can palpate. So just go ahead and take a deep breath in. Okay. Good deal. Okay. I didn't feel any masses, so everything is intact as far as palpation goes. And one more thing that you can palpate for is like appendicitis or any inflammation in the that right lower quadrant. So when you're doing that deep palpation, you want to see if there's like a rebound, and everything seems to be intact as far as that goes. Alrighty. Well, thank you, Abby, so much for being in my abdominal assessment.